When physicians fight a prior authorization denial, it is overturned 81.7% of the time. Patients also win external reviews 53% of the time. But here is the catch. 80% of patients never even attempt an appeal. That statistical difference is the action gap. Federal law provides powerful, legally binding protections, but those structural safeguards sit dormant until a patient actively triggers them. Bridging this gap requires moving from awareness to execution. These 5 federal tools are the specific, practical keys you need to start using the system as it was designed. First is preventative care at zero cost. Under the Affordable Care Act, most health plans must cover annual wellness visits, specific immunizations, and core screenings like mammograms or diabetes checks with no copay, deductible, or coinsurance. The critical boundary is the word preventative. If a routine screening discovers an issue that requires a procedure on the spot, the billing rules can change for that additional service. But the initial screening visit itself must be covered at no cost to you. If you are uninsured or choose to pay out of pocket, you have a second tool. You have a legal right to request a good faith estimate. Before you schedule a service, your provider must give you a written breakdown of expected charges. This right is enforceable. If your final bill exceeds that written estimate by $400 or more, you have 120 days to initiate a free federal dispute process to correct the charge. Federal law gives you a mechanism for both physical prevention and financial predictability before a medical bill is ever generated. Tool number 3 applies when a medical crisis removes your ability to choose. Under the No Surprises Act, emergency care is always billed at in-network rates. It does not matter if the hospital is out of network or the ambulance service is out of your plan's network. The law recognizes that you cannot shop for an ER during a cardiac event. Because emergencies remove patient choice, the law removes the financial penalty, capping your responsibility at your standard in-network cost-sharing amount. Tool 4 addresses surprise billing at in-network hospitals. If treated at an in-network facility by an out-of-network provider you didn't choose, you are not responsible for the price difference. You pay your in-network rate. The provider and insurer resolve the rest through independent dispute resolution, keeping you out of the middle. During moments of physical vulnerability, these laws are designed to shield your finances from the lack of provider choice. Finally, Tool 5 is the right to appeal. Every denial of a claim or prior authorization triggers a legally protected 2-stage review process that any patient can initiate. Stage 1 is the internal appeal. You ask the insurance company to reconsider using a fresh reviewer who was not involved in the original denial. They typically have 30 days for standard cases or just 72 hours for urgent ones. Your physician can also request a peer-to-peer review. This is a direct conversation between your treating doctor and the insurer's medical reviewer to supply clinical context that may be missing from the file. If the internal appeal fails, you move to Stage 2, the external review. An independent organization outside of your insurance company makes a final, binding decision. In the federal process, this review is available at no cost to the patient. These steps reinforce the principle that a denial is the beginning of a formal process, not the final word on your coverage. The current insurance system is built on the statistical probability that most patients will be passive and simply accept the first no they receive. But many denials are the result of simple, correctable errors, like a missing document or a clerical coding mistake, rather than a final clinical judgment. Activating these 5 federal protections shifts the odds back in your favor. It moves you from being a passive recipient of a bill to an active participant in the billing process. You now have the foundation. In the upcoming modules, we will build on this by teaching you to read your explanation of benefits, spot specific errors, and use pre-written templates to launch your own appeals. Healthcare literacy is a practical financial tool. You now know the rights that are available to you. The next step is learning how to apply them.